Welcome to Medical Associates Health Check. I'm Dr. Bristow. I'm the specialist physician for internal medicine and the founder of the Concierge Medical Clinic. And today I have with me Dr. Laisha Salvaraja.
Hi, good day. I am the clinical administrator for Medical Associates and the head of accident and emergency. And you asked, so we're delivering. We brought back Dr. Dave Ramnarayan, consultant neurosurgeon, and Dr. Robert Ramcharan, also consultant neurosurgeon.
Thank you very much. Pleasure to be here.
Thank you.
Pleasure.
So last time, gentlemen, we spoke about back pain, but a nice common subject that's coming up now is neck pain, and we're seeing it more and more often. So tell us about your experience with neck pain patients.
Well, I think certainly neck pain is becoming more and more common, and I'm seeing a lot of neck pain due to device use. So your mobile phones, tablets, and we saw during the COVID pandemic a shift towards work from home and work from Zoom, where devices not properly placed would put a lot of strain in the neck where you are looking down on a screen all day. And we've seen quite a surge in the number of neck pain patients that we see.
That's so basic, and I think everybody's probably overlooked that.
Bristol, how's your neck?
My neck is with it because I have to be on my device all the time. Oh, good.
Yeah, my kids will kill you all if they hear that.
Yeah. My wife too, probably.
But yes, it's definitely more and more common. So I constantly say it's because I am under stress and that's why I have neck pain. But the truth is I'm like this practically all the time.
That's right.
We've established the most common cause now, but what can we do about it? What is going to be the options available for us?
I think the important thing is to look at your posture, ensuring you've got a good posture. If you're working at a desk with a computer, take regular breaks, ensure you stretch your neck, you do exercises for your neck. The physiotherapist will often have quite a good regime for neck strengthening exercises. If you're working at a desktop, make sure the screen is properly placed so your head is not flexed too much. What I find is if I'm working on my laptop for long hours, typing down there, the screen is not good for where my neck is. Now, if you think of the weight, your head weighs about 10 pounds.
Some people a little more.
Yes.
Well, like you?
Yeah. See side of my
And
head.
if your head is not perfectly over your shoulder, you just tilt your head forward. That's putting a lot of strain on the muscles on the back of your neck.
Yeah.
And that is a common cause of neck pain.
I mean, when we think of it as doctors, we think of it a little more laterally. We have to think of, is this coming from the muscles and the bones in your neck? Or is this coming from the nerves or the blood vessels or, the actual spinal cord? Right? So, just walk us through how you would think of a neck pain, in a patient presenting to you.
Okay, so if a patient presents with general neck pain with no other symptoms, then it's usually muscular. Okay, and it's usually related to those factors that I spoke about, the posture, overworking the muscles in the neck. But if you have got any neurological symptoms, and the common thing is nerve root compression in the neck. And nerve root compression in the neck presents with pain. In addition to the neck, you get pain between the shoulder blades and it can radiate down the arm. So the pain comes into the shoulder, into the arm, into the fingers. And depending on the nerve that's affected, it can affect a different area. So the C6 nerve root will affect the arm down to the thumb and index finger. And the amount of patients come in to see me with neck pain radiating up to the back of the head, chest wall, and down the arm. They've been to their cardiologist. They've had their full cardiac workup thinking it's coming from the heart, but it's actually coming from the neck.
Yeah.
Right? So, but if you think it's coming from the heart, if you're getting central chest pain, it's important you seek emergency treatment first because you need to rule out a cardiac cause.
Correct.
But when that's been extensively exhausted and they just got the neck pain down the arm, it's usually a result of a nerve root compression in the neck. Now, the spinal cord runs through the cervical spine as well, and the spinal cord can be compressed. So if you find that you're having difficulty walking, clumsiness in the legs, your feet feel like cotton wool, you're getting difficulty using the hands, doing fine things such as doing up your buttons, combing your hair, then that could indicate that there's spinal cord compression in the cervical spine.
Yeah.
And that needs to be addressed.
That's like an urgent case, right?
Yes.
I know we had seen I don't know if it was watch cricket or anything. Yeah, when the guys got a blow to the side of their face or in their neck.
Yes.
And that direct trauma to the neck.
Yes.
causing some.
That resulted in the section of one of the major arteries to the brain.
Right.
And unfortunately he did not
He
survive.
didn't make it. Yeah. So neck trauma is a big deal. Yeah.
That's correct.
So, Robert, I have patients that come in with neck pain, but they also describe pain going into the back of their head and across their face and down the bottom. What could that be related to?
So that could be related to the cervical spondylosis because some of the nerves radiate up to what we call the greater occipital nerve could radiate to the posterior back of the head, which could irritate it as well too. So those are the higher nerves, okay, in the neck. And then as you get lower, the nerves then begin to radiate down to the shoulder,
Yeah.
to the front of the arm, to the fingers, and then to the back of the arms.
You also get the chest wall as well.
Chest
and the
wall as
back,
well too,
the upper
quite
back.
common as well too. We see patients
Yeah.
complain with it.
Because I think there's a lot of variation when people come in with neck pain. And like Dave had said, there was the extensive workup for the cardiac aspect is important. But I think we do neglect the fact that people get pain to the back of their head.
That's correct.
Are there any uncommon causes of neck pain that we need to be aware of and worry about?
Of course, there are uncommon causes. I mean, we could get, fractures of the neck, okay? If we had a bad injury, we've seen we've seen patients who dive into shallow water. That's a classic case,
I think there was
injure the
something
neck.
recently.
Something recently, unfortunately. We could still get infections in the spaces there in the neck. Not as common as the back, but they are common as well too. We could get some tumors in the neck as well too that could be causing neck pain as well too. Okay, tumors in the bone, and once again, cancer could spread if you have a primary cause of cancer, it could spread to the neck as well too. So those are more uncommon causes of the neck pain.
And even blood vessels too. Aneurysms in the neck.
Yeah.
Neck vessels.
Not as common as in the lower back, but we could get some of the aneurysms causing neck pain as well.
It could cause neck pain, like severe neck pain, or is it just like a niggling?
The
type?
niggling neck pain more.
Yeah.
Unless it's eroding the bone, that's going to cause a lot of pain. But usually it's not much neck pain from an aneurysm in the neck.
Yeah.
So when we come back from break, we're going to discuss the different investigations that we can do to find out what is causing your neck pain. So don't go anywhere. We'll be right back.
I was diagnosed with colon and liver cancer. Hearing the news, I was devastated. Having to go overseas, that could be stress and away from your family. Medical associate, there was no other place to go, and I'm glad that I did because they made my journey even better. I'm more comfortable. They made me part of the family. So besides my immediate family, I now have another family here. I was asking about the cost, and she was like, don't worry, we could organize. So that was a burden taken off of my shoulder. It was like a personalized thing. It wasn't just like the cost, because I've heard that it's so expensive to do this, but they treat you as an individual. I would like to thank Dr. Raghunanan, the office manager here, the nurse in particular who is here with me during the chemo, and Dr. Bim. And also Dr. Solomon, because he was the one that did the colonoscopy, but they made me feel comfortable. I would recommend medical associates because number one, the care that you receive. They make you feel comfortable and being part of a family besides your family. Cost is not that matter. What matters is to get you better. So I'm glad that I have this option here, and many other people will also have this option here if it is that they just do the research. For anyone who is going through this, don't lose hope, keep the faith, and know that once you have a positive mindset, you can get through this. Together with the medical staff, together with your family, it can be done.
At Medical Associates Oncology Unit, we know every cancer journey is unique and deeply personal. That's why our team of expert oncologists, nurses, and specialists are here to provide you with world-class care right here in Trinidad and Tobago. From early diagnosis to advanced treatment options, we offer cutting-edge technology and compassionate support every step of the way. We're here to guide you emotionally, mentally, and we understand how costly treatment can be. So, we have reduced our prices to assist you financially as well. Every aspect of your journey matters to us. With expertise you trust and care, you can feel Medical Associates, the Caribbean's #1 comprehensive and internationally accredited hospital.
So welcome back. We're gonna get into the discussion now about how we investigate neck pain. All right. So, Robert, I always stand firm on the basic examination. What's your opinion there, and how we go about examining a patient who might come in with neck pain?
Sure. So once a patient comes with neck pain, before we start examination, we need to do a proper history. How long this neck pain has been going on for? Did you injure your neck at any point? Right? What makes the pain worse? Is the pain going down to the hands? Is it affecting your legs? Okay, so history is more important than examination.
They say history makes 70% of the diagnosis.
That's right. Okay, and then when you want to find out where the problem is, then we go into examination, right? A complete neurological examination, and anybody who comes into you, okay? You test each nerve, you test the power in your hands, you test the sensation, the reflexes, the range of movement, okay? So that's our first things we do. And then once we get these two things involved, out of the way, then we decide what investigations we're going to proceed with after this.
Yeah. So sometimes, you might just take a history and examine the patient, and you could say, all right, you don't really need an X-ray, you don't need a test, and you could give them something to come back,
That's correct. That's correct. So if we're not too worried, we can just give you some muscle relaxants and anti-inflammatories.
Pain management, yeah.
But only when you do a proper examination history.
Correct. And then, in some cases, it just really doesn't help. So those patients will need some kind of investigation to figure out what is the cause. So what is the investigative ladder you would go through for a patient with neck pain?
Okay, so the basic investigations for someone with neck pain will start with plain x-rays. Okay, we do x-rays looking at the front views, side views, and with you moving your neck forward and backwards. X-rays are excellent for looking at the bone. So any slippage of the bone, any bone abnormalities, any malalignment, we'll see it. If you have a lot of muscle spasm, sometimes we see the cervical spine a little straighter than normal because all our cervical spines have a natural curve to it. And, sometimes you'd see that when you're in a lot of neck pain, you lose that natural curve that you have. So x-rays are usually what you start with, and it's good for the bones.
Yeah. And after x-rays, you might jump to a more detailed scan if your x-rays are inconclusive or you really can't make much from it.
Yeah.
Right. Or if you're saying you have nerve involvement, the x-rays wouldn't show the nerves, right? You might be able to infer from the x-rays that something might be amiss here. What else is there available?
Well, I think if you have got any neurological symptoms, pain going down the arms, radiating from the neck, up the back of the head, into the shoulders, down the arm, into the fingers. You can get tingling in the fingers, numbness in a certain distribution. Then in those instances, we'd want to get an MRI scan of the cervical spine. Because MRI scan, in addition to showing the bones, it shows the soft tissues, the discs, the spinal cord, the nerves, and it shows if there's any compression of the nerves and where that might be. If there's a history of trauma, however, and you suspect that there may be a fracture that's not picked up on x-rays, then we'll want to do a CT scan that shows the best definition of the bone.
All right.
Okay, and we often see patients with head injuries. If someone has a significant head injury, they have about a 10% chance of having a cervical spinal fracture. So you'll want to scan not just their head, but their cervical spine at the same time.
Correct, yeah.
Often we miss that. We don't do that as often as we should. And that's a very important point to make.
And yes. The x-rays of the neck can be technically challenging to a junior doctor interpretation. And it's always wise, just to the physicians there to really, if the patient is persistently complaining, I would say, really step up the investigation that you would have from what you've done before. So, I've had a patient who had an injury to the back of their head. And like you said, she had some basic x-rays which appeared normal. And then probably 2 weeks later, she's still in pain, now having neurological symptoms going down the arm. and we didn't scan her by a CT scan at the time. But when we did scan her, she had a fractured C3 vertebrae. So, I mean, it is very important, as you said, if they've had trauma and you're scanning the brain for a head injury, to really go down a little more and scan the neck.
That's right.
Yeah.
That's correct. And also, sometimes when you injure your neck, and it's important to know that we have 3 large arteries running from your body to your brain that passes through your neck that supplies the blood supply to your brain. And if you get extreme trauma, sometimes fractures, these arteries could be injured. Okay,
Right.
so sometimes if we're worried about that, we do what you call a CT angiogram, where we look at the actual arteries going up in the neck as well too. Because, you know, some people who injure the neck could get these arteries injured and result in quite major strokes.
Correct. Yeah.
I think that's an important point because we don't necessarily think about that first line, but really in trauma, that's a very valid investigation to do. Do you have any examples of cases that you had that you would want to share with regards to the importance of investigations?
We were just talking about a gentleman I had who had problems walking for a long time, and he sort of ignored it. He was walking like he was drunk. You know, he couldn't get his balance and stuff like that. And then he found that he had difficulty in buttoning his shirt. Okay, he had a little difficulty in holding his teacup. Okay, and by the time he came to me, now you realize that he was falling over when he walked. His hands were completely weak. All his muscles of his hands were what we call atrophied or wasted away. And by the time we did the MRI scan, we showed severe compression of his spinal cord from a herniated disc. Okay, so now it's not just a nerve root being compressed. Okay, it's actually the spinal cord. And the spinal cord supplies all our neurological function from our brain to our lower body. So when that's injured, we can lose all of that. So he was quite an urgent case, pretty urgent treatment.
Yeah.
Unfortunately, you know, sometimes when they come in that late to us, we don't get back full function because, you know, we can't reverse some of these functions yet. We did improve a lot though after surgery.
Yeah. And it's likely that plenty of his problems were in his neck, even though it was causing lower limb issues, right? So I think it's real important there in that story that we highlight the fact that sometimes the distribution of your symptoms in your lower limbs doesn't always mean your lower back is your focus, but you could also have problems in your neck that could cause problems in your upper and lower limbs, you know?
That's right.
Yeah.
And that's where important an examination comes into play.
Yeah.
So if I examine someone and their reflexes are brisk in their legs, it suggests to me that there's spinal cord compression as opposed to nerve root compression. And very often, the leg weakness, patients get a scan of their lower back, thinking the weakness is coming from there. And the weakness is actually coming from higher up in the spine.
Yeah.
So we will talk about treatment coming back from this break. So don't go anywhere. We will be back and we'll have a lot of juicy content coming for you just now.
AI technology is changing healthcare. And at Medical Associates, our new AI-powered MRI scans give you clearer images in half the time. That means faster reports, greater accuracy, and less time in the machine, all designed around your comfort. It's pain-free, stress-free, and right now, you can get $800 off your MRI at our St. Joseph branch. So call us now to book at 662-2766, extensions 4072 or 4073. You're in the hands of the #1 comprehensive and internationally accredited hospital in the Caribbean. At Medical Associates, we make it easier to get the clarity you need with the care you deserve.
Our CT scan services are quick, comfortable, and designed to detect internal issues early, often before you feel a single symptom. Because the best way to treat something is to catch it early, and Medical Associates makes that easy. Just call or WhatsApp 342-7061 to book. It's that simple. You're in expert care at the Caribbean's #1 comprehensive and internationally accredited hospital. Don't wait for signs. Take control of your health with ease and confidence at Medical Associates, where care always comes first.
All right, welcome back. So we're gonna get into the talk about fixing these problems in the neck and what treatment options we have for patients who have neck pain. All right, so I mean, we kind of strategize in our heads as physicians, conservative versus making an intervention. How do you guys go about
Make a
doing that?
decision.
Sure. So once a patient with neck pain comes into me, right, the first thing I want to make sure is that, there's no compression of the spinal cord. Okay, once again, a good history, an examination, proper MRI scan, right, will tell me this. Then I want to make sure they have good function in their hands. Okay, and then usually our first win for just neck pain alone, and maybe even a little bit of numbness in the fingers, okay, it's going to be conservative, right? As I said, conservative. Conservative doesn't mean doing nothing. Okay, conservative means doing something, but not surgery.
Right.
Okay, so conservative, we're going to start with basics or lifestyle changes. Okay, I mean, it's harder to get somebody off the phone than anything else in this world. Okay,
Cue us.
no matter what you tell them. Okay, make sure they're in their work position, they have an ergonomic workstation. Okay, and sometimes you might even need to get an occupational therapist involved to help you with that ergonomic workstation.
So you would make that recommendation to the employers?
I usually do.
Okay.
I usually think if that's an issue with them causing the neck pain, which is a lot in people who sit for long hours, I say, no, let's get an occupational therapist to go and see how you're working and give some advice on how to set that workstation a little better. Strengthening the neck important with physiotherapy. Okay, that's quite important as well too, and proper posture as well too.
Gentle physiotherapy. I mean,
Gentle physiotherapy, and this is one where we advise not to go by the person who's going to crack your neck, because we mentioned before in our last segment, we have some important vessels going to the brain, and it's well documented that people have had the neck cracked and ended up with major strokes, even death from just having this manipulation done, from injury to these blood vessels.
No, I remember in the back pain episode, you had described that the mattress that people sleep on should be appropriate. What is your view on changing things like the mattress and the pillows and things like that? Because a lot of the time people don't change their pillows for years. They have the same one for about 5 years and they wonder why they have neck pain.
That's correct. So mattress important. I mean, usually you have to have a mattress replaced every 5 to 7 years. Okay, and I usually recommend you go and you try a mattress out before, make sure it's your proper comfort level. Okay, and as well too.
Like just go and lie down on
just
it.
Go and lie down and
No
just go and lie down and
try it out.
And then, of course, you need to have a proper pillow as well too for that proper neck support as well too. And they do have some expensive cervical contoured pillows that will fit the alignment. I mean, I don't necessarily say you have to pay a lot of money for it, but I mean, a proper pillow to support your neck is important as well too.
Okay. So moving on to more invasive and interventional options, what would be the next step in treatment?
So I think if I found someone to have spinal cord compression with weakness in the legs, clumsiness in the legs, difficulty using their hands, then those need fairly prompt surgical treatment. It means there's spinal cord compression, which would have been confirmed on MRI scan. And it all depends on where the compression is. Is it in the front of the spinal cord or is it in the back of the spinal cord? Okay. And our surgical approach will depend on where the compression is. So from the back of the neck, we can do a laminectomy where we make a vertical incision at the back of the neck. We get down to the affected level, remove the lamina, that's a ring surrounding the spinal cord, and sometimes we have to reinforce it by fusing the bones with screws and rods. Or if we go from the front of the neck, we usually make an incision in the skin crease in the neck. So when that heals, you can't see the scar. There's a natural corridor which takes us down, but down to the spine, we remove the offending disc from the front, or if we have to remove a vertebral body which is diseased, we can do that from the front of the neck. The patients will get some mild difficulty swallowing for a few days, which settles once the swelling settles down. But these are fairly safe routine procedures that we do.
And I mean, if these patients, I mean, some patients might not be suitable candidates for surgery despite having severe disease in their neck. Let's say they have significant, the technical term for it, myelomalacia, where that arterial spinal cord is basically non-functional or barely functional.
Well, I think the important thing is to preserve whatever function they do have. Mm-hmm. And if there is myelomalacia, means that there's already irreversible damage to the spinal cord, mm-hmm. but it may not be 100% damaged. So sometimes when we decompress the spinal cord, it stops the further deterioration and preserves whatever function they have.
Right.
The problem with our nerves is we are born with a fixed number of nerve cells and they never multiply in life. So if someone has irreversible damage, their function will not get back to 100%. They may get some improvement, but not back to 100%.
Right. And I think that's important that you highlighted that, because, I mean, when some of these patients like the one that you had, Dr. Ramcharan, when he came in, it's probably late.
Yes, correct.
They may present late, right? And then at that point now, we have to kind of manage the patient's expectations for recovery, right? Really keep them grounded as to what you can expect. I mean, not all the time these surgeries are 100% corrective.
Curative.
That's right.
And I mean, there are very few times with me and Dr. Ramcharan will recommend surgery as you come into our office. Very, very few times. But when we see spinal cord compression, we're always worried about worsened paralysis, and we know we can't correct this if it gets worse. Mm-hmm. We usually would recommend surgery pretty much even before we start physiotherapy. Mm-hmm. So if you come to one of our offices and we recommend surgery right off the bat, it's because we're worried about some irreversible changes happening.
Okay.
Yes,
So
if we left unchanged or go into physiotherapist.
what about someone that you've chosen to have for conservative management? Do you just keep them on follow-up for a certain period of time, or do you see them every month? What is your follow-up like for those people?
So once we start a plan with them, okay, so people who we think could benefit from conservative treatment, we start them on a course of physiotherapy. We usually recommend go twice a week, plus to a home exercise, and then we usually follow them up on a monthly to 6 weekly basis for the improvement.
Okay.
A lot of them improve. If some people don't improve after 2 to 3 months, we may consider scaling up to other, maybe surgery at this point.
Okay. All right. So unfortunately, again, that's all we have time for. We thank you both for coming today because we really appreciate it. And the last segments were very well received. Again, just like last time, we're actually offering a discount on neck surgeries for the next 6 months. So feel free to contact us on 662-2766 and extension 4028 to speak to our customer service team. Thank you very much for tuning in, and we will see you next time.